Treating the rising number of COVID-19 cases will put immense pressure on our healthcare system. And that's why you've been hearing the term flatten the curve. The goal is to do what we can to limit transmission ourselves so we don't overwhelm our hospitals and medical workers. Doctors are bracing for a surge in patients, but many hospitals were already operating at capacity before this. Eric Sorensen reports.
Humber River Valley is one of Canada's newest hospitals, as ready as any to treat the outbreak of COVID-19. But this hospital and others can only take in what they can. Italy has a top-notch healthcare system too, and it was simply overwhelmed.
Our hospital systems in Ontario and in Canada routinely run at 100% or higher. So any surge outside of our normal activity gets us into trouble. If we take the worst case scenarios, kind of like what's happening in Italy right now, we could vastly overwhelm our hospital's ability to care for everybody, especially our intensive care units.
1 month ago, there were 8 cases in this country. A week ago, there were 96. Look at how the numbers have jumped upward since then. Over the last 4 days, cases more than doubled to 597 Tuesday night. At that pace, doubling quickly, there could be 30,000 cases 1 month from now, and that is a conservative estimate. With the numbers rising then, the worry is the healthcare system's capacity. There are only so many ICUs and ventilators. If the numbers spike beyond capacity, there may not be enough facilities and care for everyone before the pandemic breaks. With precautions like social distancing, the curve flattens. Cases can rise more slowly, can be managed over time, and Canadians can count on getting the care they need.
And so if you can spread it out so that they're not all showing up in the same week, but you spread them out over many weeks or months, then that's what we call flattening the curve.
It's still relatively quiet now, but Humber River Valley expects a surge in patients soon.
We're not under any particular pressure to care for these people, but that will change very quickly as the cases continue to rise over the next couple of weeks.
The experts can see what's coming.
So that's why the decision was made to act now. And so that's why, we really need everyone to exercise social distancing as best as they can.
Canadians can still make a difference, and Canada can still avert the level of crisis they're coping with in Italy. Eric Sorensen, Global News, Toronto.
As cases of COVID-19 increase across Canada, healthcare systems are getting ready for an influx of patients. Heather Yerkes-West looks at how hospitals across the country are preparing for the weeks ahead.
In the war against COVID-19, hospitals are the front lines. And in cities across Canada, the battle has begun.
There are a number of patients coming into the emergency department with respiratory failure due to infectious concerns as possibly COVID-19. The emergency department staff are trying to take care of them to the best of our ability while keeping protected ourselves.
For hospitals that usually operate at or beyond capacity, work is underway to ensure there is space for new patients.
Alberta Health Services is postponing all scheduled and elective surgeries. Urgent and emergency surgery, as well as oncology and scheduled cesarean procedures, will continue.
Not every person infected with the new coronavirus will need to be hospitalized, but as many as 10% could require intensive care. Quebec's premier believes his province's health system is ready.
We have already 2,300 beds that are waiting in case we need to use them for the coronavirus.
Of course, it's not just space that will be required. Work is also underway to bolster supplies and staff. In Alberta, 300 retired doctors are being asked to return to work.
We will be reaching out to those physicians later this week to ask them if they have an interest in coming back into practice throughout this pandemic.
But the fact is, all this preparation may not be enough if the virus spreads too fast. Several provinces have plans for things like field hospitals if the number of sick surge. But even with social distancing and self-isolation, there is a real threat that healthcare resources could be overwhelmed. Heather Yerkes-West, Global News, Calgary.
We know you have lots of questions about this virus. Jeff will continue to consult with experts and try to answer them. So email your questions at globalnews.ca. On our website, you'll find a special page dedicated entirely to the new coronavirus. That's at globalnews.ca/coronavirus.